From day one on the job, a little over 2 months ago, I made protecting the lives and livelihoods of our residents my top priority. Y desde el primer día, proteger la vida y el sustento de nuestros residentes es mi prioridad. My first act as mayor was to appoint our first ever chief medical officer, Dr. Peter Page of Jackson Health System, who's worked closely by my side for the last 2 months to help craft a public health response and economic recovery plan grounded in data. And now that the vaccine has arrived, and with it our opportunity to finally put this pandemic behind us, we can and we will. Since the very first person was vaccinated in Miami-Dade, the Office of Emergency Management, led by our director, Frank Rollison, has been working to build a county-wide vaccination program. Together, across the county, we administer over 20,000 vaccines per week, and we are ready to scale up to several times that number once we have the supply. We need vaccine. We continue to demand more vaccines from our state and federal government to get us the supply our people desperately need. We are ready to put shots in arms. We just need the vaccine. And while we've quickly put systems in place to distribute vaccines efficiently and safely, we must also ensure they're being distributed equitably to protect all our communities and to move forward together. And this is why my administration is soon rolling out a new centralized registration process for vaccine distribution. This platform, which will be accessible online and by phone, will allow all seniors 65 and above to sign up to receive a vaccine. A one-time registration, no need to constantly reapply. And it will allow us to fairly allocate vaccines as quickly as we receive new supplies. The bottom line is this: your access to a computer or the zip code where you live should not determine how quickly you can get vaccinated. That's why we're also partnering with nonprofit, community, and faith-based organizations to get the vaccines to those who are hardest to reach. And this is why, since December, we've been distributing vaccines directly to vulnerable seniors in public housing and those under county care. We've worked to overcome barriers of trust and credibility with the vaccine by investing in a messaging campaign to reach directly into underserved communities, to listen, answer questions, and seek to educate and inform. We need all our seniors and all of those most vulnerable to this disease to share in the newfound freedom and hope the vaccine brings, and with it hope that we can kickstart our full economic recovery. This won't happen overnight, but I'm committed to leading our community through this critical final chapter of the pandemic. We can protect our community with this life-saving vaccine, and we will move forward together. As we look to the future, building a more resilient Miami-Dade means not just weathering this crisis, but rearranging the foundations so that we can rebuild better. Working together to overcome challenges like we have never faced before also gives us the chance to reimagine a safer, more just, and more prosperous future. We cannot just go back to how we were before. We can and we will create a stronger, more resilient Miami-Dade with these 4 E's: a commitment to equity, a sharp focus on invigorating our economy, key investments in our environment, and greater engagement with and input from the people we serve. How will we equitably improve the quality of life of our residents and ensure every part of our community is thriving? We'll dismantle barriers to opportunity and take on social injustices. We'll invest in small business and tackle affordability and mobility. We'll protect our clean water and safeguard our community against rising seas. And we will engage directly with the community to bring new ideas into our decision-making and deliver a more compassionate, caring, connected government. It all starts with putting access and opportunity at the core of the work we do as a government. Leveling the playing field for all our families has been my life's work as a social worker, public interest attorney, and public servant. Crear oportunidades para todas nuestras familias ha sido el trabajo de mi vida.